It's just a couple more, then we're ready. Buttons to push these days. Ladies and gentlemen, you're listening to Louis B. Free Radio Show, Brain Food from Heartland. April's Occupational Therapy Month, and I have a very special guest. Introduce yourself, if you would, please.
Hi, Louis. My name is Tamara Jackham. I'm an occupational therapist. I've been an OT for 25 years. I'm semi-retired right now, prior COVID, but still keep my credentials up. Just received another credential, a fall specialist, because I was up for national board recertification, and that I finished that in March. So I have my cert again in my state licensure for the state of Massachusetts. I live in Western Mass. I'm married. I have 3 kids. And I really enjoyed my career. Very good career path, and helped many people along the way, I hope. Had some really great patients, great kiddos. And it's a very rewarding career. And I highly encourage people to reach out to an occupational therapist if they ever feel they need help, and we can discuss what we do, because people don't really know what OTs do.
And I want to talk a little bit more about that, but your path, why occupational therapy?
Well, years ago, my grandmother had a brother who was profound. He lived at the Belchertown State School, and that's in Western Mass, which is now closed. He was nonverbal, self-abusive, and my grandmother had to quit school in 6th grade to take care of her siblings because her father had died, and my great-grandmother worked in the jute factory. Oh. So they said he would never do anything. However, he learned how to put his shoes on. He learned how to toilet. It took him 20 years. He learned a lot of things. A matter of fact, Mr. Kennedy from Massachusetts, Senator Kennedy, helped my mother and my grandmother get him out of the Belchertown State School, out of a block he was in because he was getting beat up. He ended up in a group home on the state school campus. But to get into the group home, he had to learn skill sets, and the skill sets were setting the table and clearing the table. So they worked with him, and he was able to do that job. He worked in the greenhouse. He loved flowers. He would grow flowers, and they would sell them for to the public. So I asked, how did he learn these skills? And it was by an occupational therapist that worked for the state. And then I researched it, and I really liked it.
It's so broad what you do. Mm-hmm. Reading about it, understanding it a little bit more, having personally gone through some physical therapy, cognitive therapy, and you're suggesting occupational therapy for me. Tell me about the breadth of it. I mean, you tell me, you know.
The way we like to do it, like PT works on so just so you can kind of get an overview. This is how we explain it to our patients, our adult patients. PT works on biomechanical stuff, range of motion. People have surgeries, they work on the range, pain, backs, necks. Speech therapy works on cognitive, articulation, swallowing, so people don't aspirate. Maybe augmentative communication, like a computer. And OT overlaps with both of them. So, for instance, with physical therapy, we will work with a physical therapist, but we work on activities of daily living, which will encompass your hygiene, cooking, cleaning, activities that you like to do that you might not be able to do due to a cognitive impairment or a physical disability. And we give you the tools and suggestions how we can get there. We do work on strength and endurance and balance. We work closely with speech therapy in the school setting and in rehab. We consult quite a bit on how we can bring their cognitive therapy in with functional tasks, such as dressing, such as cooking. So, and even issues with fine motor, if they have to work on an augmentative communication device and they have to do eye scan. We do a lot with visual perceptual skills and fine motor function. Some therapists specialize just in hand and upper extremity therapy. These therapists have numerous hours that they have to log in to be a certified hand therapist, have to take an extensive exam, and they know their stuff. They make hand splints. They do therapy on, people who have surgeries or amputations on their fingers or hands, arms. We work with children with autism, learning disabilities, and we work with them to make them independent with ADLs and to be able to access their environment, either due to being sensory overloaded, not maybe in physical stuff. We look at the whole person and we try to make them whole again, either with adaptive equipment, modifications to the home environment. And we work closely with speech behavior analysts when we were working with people with autism or dementia. And we work with physical therapy, speech therapy, and educators. In nursing, we work closely with the nurses in rehab or home health care, so they know the status of the individual. So we work on safety. Safety is a big one too for children and for adults that might have cognitive or physical impairments.
Wow. I mean, it's very broad.
Yes, it is. And the thing with OTs, if somebody, you need, occupational therapists, ask the questions. It's like going to a doctor. Do you have experience working with autism? Do you have experience working with dementia? These questions are experience working with a dyslexic person or a learning disabled person. These are really important for outcomes. Also, it's very patient-centered. The patient tells us what they want to work on. Like I may say, Louis, we're going to work on cooking, but you may never cook. You never cooked in your life. Your wife does all the cooking. Why would I address that goal? So it's very important to ask the patient, what do you need to do? What have you done before? And let's discuss how we're going to get there. Sometimes, I'll be honest with a patient, someone with a stroke who's paralyzed. I'll say, we can address it and we'll address it hard, but I can't guarantee you'll use your hand again. But we can work on it because I don't have a crystal ball. We can address it. So, I think if you're upfront too with people that you might not attain that goal, you might attain another goal a little bit less, and we talk to the patients throughout the therapy or the parents of the child.
That's deep because you've got to understand the individual. It's
yes. Cultural too. I mean, there's a lot of cultural things too. Like I worked in the Vietnamese community and they share like toothbrushes and they shared razors, and we had to discuss hygiene and how this can affect their health and the health of others. There's certain topics, that are very sensitive. To be truthful with you, the most important thing that every adult patient and even every parent I've talked to was toileting. We work on toileting extensively so people can be independent with toileting. And when that is taken away from an individual, they all feel like they're degraded. It's degrading. And they want to be able to do this themselves. And so we work on transfers to the toilet. We work on wiping. We work on fine motor, gross motor, safety in the bathroom, and tub and showering too. People want to take shower and dress themselves. So these are really big things, even for parents. They want their children to be independent in these areas. And I can't agree more.
It's got to be very rewarding for you when you see them. Go ahead.
I love it. I love my career. You know, when you get motivated patients, even if you get patients that are depressed, they come in, oh, I can't do it. They get very bitter. They can be very angry. You have to establish that rapport from the get-go and say, let's just try. Let's just try to address this. You know, give me a chance. And then you get that rapport going, and they trust you. And that's a big thing. You have to trust your therapist, whether it's a speech therapist, physical therapist, or occupational therapist. You have to trust them, and trust is a big thing with therapy, no matter what kind of therapy it is.
It's interesting when you say that. And I have talked a bit. I did a show a couple of months ago called Outing Myself with Lewy Body Dementia. And I've done a couple about Lewy Body Dementia. Too many questions from too many people about what was going on with me or what was wrong with me. And I was diagnosed with Lewy Body Dementia. And I remember, you and I've talked about this, that when it was first, when they said I needed to go to physical and speech therapy from the Cleveland Clinic, I don't want to say I wasn't resistant, but I thought, what's this going to do? Firstly, the movement stuff, the Lewy Body Dementia with Parkinsonisms, the movement stuff for me is not important. It's the other things. My movement's fine. I tremor a bit. Sometimes I walk funny. Yet the things I learned from the physical therapist, I was surprised that, because I've integrated some of them, I've used them. And again, I was all in when I did it. I just wasn't sure how it was going to impact me. And months later, I see where it does. The speech therapy, I understand the choking, will be problem down the road. Yet I've learned so much with the cognitive things that, and both wonderful therapists. Yeah. And focusing on different things. And it's just, I had no idea of the value. I thought those things were for somebody else, or I'm not at that place yet. Well, you want to be prepared to, when you get to that place, with someone that's got something, and I'm sure a lot of other things hasn't progressed yet, you need to learn up front, as opposed to, I can't do that right, or I'm not speaking loudly, and then to try to, am I making any sense?
You are making sense. You know, it's funny you said about the
for myself.
No, you're making perfect sense. It's funny that you talk about swallowing, because I did do a lot of swallowing with speech therapy with children and adults. We work collaboratively during lunch times. I did take an extensive course on oral motor and swallowing. And so, you know, that is an OT thing too, because you have to eat. We look to, like, if the speech therapist and I see a patient, let's say it's in a skilled nursing facility, I might recommend, like, the patient, they're eating, she's watching the swallow, I'm watching the hand, I'm watching the visual motor. Is that person neglecting like part of their plate because of maybe Lewy body dementia or Parkinson's or dementia? What adaptive equipment can we use so that patient can scoop that food, get it to their mouth without assistance? How can they take a sip of their drink? What type of cup do they need? You know, it's so nice to work with therapists that, you know, you work collaboratively, and two minds are better than one. I always feel when you work in isolation, you're not seeing what the other therapist is doing, whether it's PT or speech, and you really kind of need to see that happening or talk to them and read the notes, and sometimes overlap. It can be an overlap in the clinic, can be an overlap And skilled nursing facility can be an overlap in the public school system, can be an overlap in the home environment. But even that 10 minutes really can impact each therapy on how they want to get their goals, the consultation, and the goal is independence and safety, whether it's eating, like you said, dressing, toileting, mobility, even with physical therapists, because I've worked with people with dementia with walkers, and the PT's like, oh, she's always forgetting her walker. She's going to fall. And I said, listen, we have to catch people before they get to that level of forgetfulness. We have to encode that in their memory. How do you get up from the chair? Take the walker, because once that skill set's learned, they'll keep it. You can't, it's hard to teach somebody once the cognition is really going downhill. So to be proactive, you start that when they're able to, quote unquote, learn new skill sets. And it has worked out very well, in all, whether you're getting therapy in any environment, and to educate the family. The family is very important in this because they have to understand, they have to be there like, oh, what are you forgetting? That cue, wait a minute, you didn't get out of that chair. How do you get out of the chair? Practice with them on the days they might not have therapy if it's in the home environment, because you're learning. So the more you do, the more it encodes and the more it becomes rote.
Yeah.
That's the long-term goal for safety purposes. So that's why OT, if they recommend it to somebody and you say, oh, stop, I'm not there yet, I don't need it. It's kind of good to get in early and then work on that. So that's why, if they do refer, I recommend at least you go for the eval and see what they say and tell them, this is what I want. And safety would be the priority, and not falling during ADLs, like getting dressed in the morning. That's a big one. Bathroom falls, Louis, are very, that's the highest place where people falls in the bathroom. So we have to we really instill that in people, especially during toileting at night. People fall backwards and they can really hurt themselves, break a hip.
And again, like you say, showering, people want the independence. They want to be able to, as long as they can, to be able to go to the bathroom by themselves, certainly. If kids or older folks like me want to be able to shower. Mm-hmm. And when you learn some of the things, like you were saying, again, I wasn't dismissive of the physical therapy. I did it. I did my homework, etc. And that was months ago. And I see how it's helpful to me now and will be more helpful down the road, certainly.
Yes,
you learn it when you are able to, before you need it.
That's what we hope. I mean, my uncle had Parkinson's, and I've worked with my areas like people with neurological diagnoses. So in the nursing home, I always got the Parkinson's patients. I always got they call them heavy hitters, the CVAs, heavy hitters. That's what they would call them. Not to be disrespectful, but they do have a lot. And that's the other thing, you have to prioritize. So your goal might be, I want a toilet. I've had a stroke. I want a toilet. The wife's saying he needs to get on that toilet, or the husband, she needs to get on that toilet. I can't lift her. That skill set will be broken down by me in component parts, and we will look at it from going, let's say, from the wheelchair to a stand pivot to the toilet. But I break it down and we keep doing it and doing it and doing it. And patients will get mad. I say, I know you're getting mad at me, but you didn't do it right. You're not safe. Because people, when they have a stroke, they're quick. They want to get it done. No, we have to. And as long as they can transfer onto that toilet safety using adaptive equipment and working with physical therapy too, I have them come in here, look at this. I just want to make sure it's okay with you the way I'm doing. It's fine. So those are things to break them down into component parts. So the patient might say, God, we did this 100 times. And I'm like, well, you didn't do it right 99 times. So yes, let's try to get it right. And, you want to go home and you want to, yes. And I says, I know I'm like a drill sergeant, but I'm only doing it for your best interest. And if I didn't think you could learn it or do it, I wouldn't even, I would have gave that up a long time ago, but you're making gains. So let's keep going forward. So when you get out of here, you're safe. Oh, I get it. Okay.
Yeah, it's wonderful when you see that breakthrough, right? If they're resistant and yeah.
Oh,
Tell me.
I had a patient that had a massive stroke in a foreign country. It was in the ICU for many months because couldn't travel back to the States. Finally got a medical transport back, stabilized. Patient went to rehab and came home care. I was asked to go on the case from the physical therapist because she knew that I had experience. This patient was stiff as a board, 6'5", couldn't roll, couldn't move, couldn't do anything. The wife got over cancer, tiny petite thing. He'll never walk, I can't. And I said, listen, we're going to work we got to start from the basics, rolling. He needs to be able to roll to one side with the bed bar. When you're looking at a developmental progression, this is what they teach you. If you know pediatrics, you'll know your neurological patients, because the neurological system goes back to that, pediatrics. So first the baby kind of learns how to roll, they rock, so you're starting with that. Eventually that patient was able to do a stand pivot transfer, just being spotted by the wife to get into that wheelchair, which was, I can't believe it. I can't, he was crying. He was crying. Finally, we got him up to a Hemi Walker level, standing, looking at himself in the mirror. He was able to transfer onto the toilet. His left hand didn't work. His goal was to email his brothers across the country. His vision was off on the left. He couldn't see well. So we worked on the iPad and voice to text and highlighting the text and blowing it up so he could do something while his wife cooked. And it was like, it opened up a world to him. So we started off at rolling, to sitting on the edge of the bed, to transferring to standing. And it made the world a difference for the family too, because they could take him out in the community.
It's got to be very soul satisfying for you.
Oh, yes. OTs are, and they have to have that heart. I see people in the medical field that have this guard up. And I don't think a guard is a good thing. I think you have to have a big heart, and they can tell when you're being genuine, that you're excited for them. I am a very animated person. I mean, you can tell by talking to me now, but when it needs to be serious, I can be very serious. And less is more. Less verbiage is more. Less contact, maybe physical contact is more. And people need that to be able to process commands, maybe, whether it's probably neurological. Less is more, I always say, with talking.
It's wonderful. But you think about, again, being able to help people like that, regardless of where they are. I do want to talk about the research study that you were involved in, but I can feel your heart in it. I can feel that.
Yeah.
And that's a beautiful thing, to be able to have that desire to help people. And I also understand, having had probably more doctor appointments in the last year than probably the prior 20 combined. Or it's interesting when I appreciate when people really obviously know their stuff and present it to you. When they do it with some heart and they listen
Yes.
And I've been very fortunate to, they call it my team. I have
Yes.
a few in there that,
Yep.
that really listen and hear what your concerns are and address them. But again, I understand they've got a lot of experience, so I want that also. But it's just, it's amazing when you come upon someone that seems to really get you and understand your concerns.
It does. And I think, we're all humans, and, not to bring up anything, I've been there where I needed help. I had a spinal fusion in my neck. It was very painful. So they put, I came home, I was afraid to fall because I'm like, oh my God, if I fall and I got this hardware. And so I've had some obstacles in my life, and, I get it. And I took care of my elderly parents who had obstacles too. And to be an advocate for patients and be an advocate for your family, and being through the process with doctors like you have, it really puts a different perspective on it. I've worked with young OTs that say, boy, Tamara, you get it. And he says, it's part of its life experience. I mean, when you're dealing with people with, Parkinson's, cancer, heart disease, diabetes, and it's impacting spinal stenosis, impacting them in their daily lives. Yeah, you go to these doctor's appointments, and you listen, and then you learn how to ask the right questions in the right way. That's the other thing I'd like to talk about, is that we understand that patients and their family members can get very, very demanding, very agitated, and it's hard. And you catch more flies with honey than you do with vinegar. My mom always used to say that.
Yeah.
So that's why when I've come across some families like that, and it's, I say to them, listen, we're all here for the main goal is for your family member. So we all have to work together and be respectful. And, sometimes the family member would say, oh, thank you, because my kids can be so like, oh, and I go, I understand it, but I can't be, she can't be verbally abusive to me or anybody. I mean, it didn't happen a lot, but sometimes you have to kind of set the tone. And, the patients are afraid to set the tone because they're afraid what the family might say. Like, you can see the eyes rolling. So I think even with doctors and any type of medical professional, nurse's aide, home health aide, people can get their point across in a nice manner. And that's great. And I just want to say that, we do come across that sometimes because they're very nervous and they're very, they want it done tomorrow. They want them better tomorrow. And I always would say, believe me, if I could wave a wand, I would, but it's work, and it's work on all of us. And the family is part of the team. So you can't discard the daughter or the son or the grandparent. They are part of that community. And especially when you're going into someone's home, you have to be respectful because that's their environment. And you have to abide by what they want. So it can be tough, it can be tough sometimes.
I also feel that I don't understand, and I've heard that also, it obviously much better than I, that people have an attitude or are demanding when they go to a therapist or the physician, the doctors or whatever. I just don't understand that. You're there for help. You're there because you need to be, you want to be there. You're getting the help. Why would you be nasty or impolite? Or I don't get that. I don't understand that with people. And I understand the frustration. I understand that. I know with me, with Lewy body dementia, that it's referred to as chasing a diagnosis. Realizing that mine started at least a decade ago.
Yeah.
And when you get that, you don't know. It's like, what is this? And it's a learning process then. And some things, again, using myself as an example with Lewy body dementia, you find out how little some people know. I'm talking about in the profession because it's not as common. And I get that. It's like, fix me. So what,
Yeah, it is.
and it's, again, my diagnosis, no slowing it down, no cure, ultimately fatal. Neurodegenerative. I understand that. That's a lot to take in because, again, we feel, and we've got great people working in the medical profession, very bright people. You find something, well, we try to manage and things, but there's very little that can be done when you think, just fix me, cure me, doc. What do I take? And the medicines also, with mine, again, there's the one for the tremors and the movement can cause hallucinations with the Lewy body. I mean, you've got to really be accepting of what it is. And I know you've dealt with a lot of people with this and understand what you need to know and deal with it. Go ahead. Say,
well,
my cog's a little off.
No. And I would tell the people too, sometimes you need to go talk to someone about this, whether you go to a, social worker or, I think it's important to be able to deal, like you said, with this, because you're not getting better. There's like ALS, you're not going to get better. It's a hard thing to accept. Cancer, you can get better. I'm not, not everybody does, but you can get better. You could, God forbid, people can be paralyzed, but they can be functional. It's not fatal. Like they get in a car accident, they lose their ability to walk, but they can be in a wheelchair. It's a different type of, oh my God. And then accepting and then moving forward. So I do believe that therapy, like talk therapy, is good. And OTs do talk therapy too, just to, as part of the team, like, this is what's going to happen, and we need to address it, and we have to be kind and sensitive, because it is very, very difficult to be facing something like that. With that being said, working with children with autism, severe autism, the parents, they are very mad. They can be very mad. They want the best for their child, like any parent wants. And they want their child to, quote unquote, be normal. And I understand that. I have a child with autism, and like you said, chasing the diagnosis. I had to chase the diagnosis. He was born in 1997. At birth, I knew there was something wrong. He was in full extension patterns, screaming, yelling, couldn't calm. Even the nurses were saying there's something wrong with him. ICU was called. They did their assessment. He wasn't going into ICU, but he ended up being in the nursery in a special bassinet that would swing. And I brought him home. He screamed for the first 3 years of his life. It was not easy. I had a daughter who was sickly, very sick. And I had this child that people basically were telling me that it's all in my head. It's you. You're not managing your child. And I'm like, even my mother, who had me very late in life, I'm an only child, said there's something wrong with this child. He doesn't make eye contact. He eats things off the floor. He licks the windows. He bites you. He spits at you. He projectile vomits. He doesn't eat right. He's drooling all the time. There's something wrong. He had pica. I mean, this went, and then my husband was in denial, saying it's all in your head because you're an OT. You think you know everything. There's a lot of things that happen within that home environment when you have a child like this. It takes a lot of time and work. And I finally got the diagnosis. I mean, my son was severely autistic. I finally got early intervention in it too. OT, PT, speech therapy, and an educator to help me. And they said, oh no, he meets the criteria when they did their assessment, and speech went, excuse me, no, he's very delayed in language. He has no language. He has no language at all. He's 2 years old. He doesn't even make an utterance. No, he needs services. Thank God for that speech pathologist. And she spoke her mind. She's like me. I'll never forget her. She knew her stuff, and she knew that there was something wrong. She didn't know. No one knew it was autism, but we knew something was wrong. Whether it was brain damage, I mean, I didn't know. And then we went chasing the diagnosis, and finally got it. And it was really hard for my husband, and it was hard on our family. It's a hard diagnosis for parents, and it's kind of like getting a diagnosis like you have later in life. It's hard. So I want to, parents need to be proactive, and if you think there's something wrong, there is. Parents, if you go with your gut, always go with your gut. And I even told my patients, my elderly patients, you go with your gut. If it's because your brain and gut are connected, and if it doesn't feel right, it isn't.
Yeah, your brain.
Like you said, chasing the diagnosis, you knew something was wrong. Your gut was telling you there's something wrong.
Yet with you, it's different for a child, for the parents and a child. I'm an old man, so I appreciate you drawing a comparison, and I'm not being argumentative, but it's can't compare that.
No, I understand. I mean, I think too, when you have a child diagnosed with this, their future, what will it entail? You don't know. There's a lot of things that can happen to a child. And, you worry too, when you die, who will take care of this child if they can't take care of themselves? I mean, that's a big one. It's a real big one. And I just, we've been to Children's Hospital Boston. We were at neurologist here, primary care, pediatrician, primary care. And I went to work in a school for children with severe autism, and I'm watching the behavior, and I'm like, my God, that's my son. Projectile vomiting, like when they get mad, they, yelling, biting, kicking, throwing up their shoes, rolling on the floor, toe walking, chewing on their clothes. So I had the director of the school come to my house. I go, could you do me a favor? I'll pay you even. Can you look at my son? I swear he's autistic, and people are just telling me he's not. And he's the quote unquote mentally retarded. That's what the school teacher said to me. And I said, you know what? The doctor hasn't even said that. And she says, well, I have 3 master's degrees. I said, you know what you can do with those 3 master's degrees?
Yeah.
So she did come, and she says, she came for a couple months, and she'd come every Saturday and work with my son. I mean, my son was sign languaging up to 3 years, 4 months. He was nonverbal, but he'd sign. Then the speech came out in sentences, 10-word utterances, but garbled because he had low tone. It was unbelievable. She's the one who called the psychiatrist, and this psychiatrist respects this ABA therapist, PhD, and said, you're the best in the business. I agree with the diagnoses. And that's how he finally got the label and got the services he needed in the public school. I was prepared for my son. I told the team, I want all this testing done. I want him to have all these therapies. I want education, like an IEP. And he made really good gains with applied behavior analysis. I paid for it at home, but OT, PT, speech, and special education. He was finally talking. He's been in studies with UConn Stores. He's been in studies with Mass General, to help others with autism, because he went from severe to an high functioning autistic, because now there's a spectrum, but he's really kind of Asperger's. He still has quirkiness, but I always enrolled him in these studies because I figured it would only help us with the evaluations they would do. And then they follow up with him every year or every so many years. And I encourage any parent who has a child with autism to, if you can, get into studies with universities, because they do help tremendously. And then you get to read the outcomes. And so my son was in the Alto study out of UConn Stores, and they interviewed him as an adult, and they wanted to know why some kids with autism, like where he was, because now you're following a child through, grade 3 now to 23 years old. How come these kids made it and are functioning and went to college or working, and then some didn't make it? And so that's really important. And we really need to know this, because I feel the younger you get in, the therapy provided, the neural connections are made, and it's hard, and it's hard on the parents, just so it's not easy. And parents really need to follow through on what the therapist said. It's a full-time job, and I couldn't work during that time. My job was my son. And I was prepared for him for a group home. My husband was prepared. We talked about it. And now he has 2 bachelor's degrees and a minor. And,
Sorry.
No, it's all right. I mean, I always tell my patients, never say never, and always shoot for the stars, because if you don't try shooting for that star, you'll never know if you catch it. You'll never know if you don't try. And that's what I told the team. All I want you to do is, like when in the school system, when he's up for his evaluation, just give me the results, and I'm going to hash it out with the SPED director, and we're going to go with the goals. In 4th grade, they dropped the ball on him. He regressed 3 years, and he ended up in a district placement in the state of Massachusetts. Told the district, you failed to educate this child, and now we have to send him to a specialized school. So he ended up going to a specialized school for boys with learning disorders, because he had Asperger's, and where we live, they don't have autistic schools. But that was the best thing that ever happened to my son. And he even says it, Mom, if I didn't go to that private school, I don't know where I would have ended up, because it was 1 to 2 educator for reading and writing, classes of 5, and it was all boys, and they had to wear sport coats and ties and mandatory gym. There was no like, oh, I don't want to do that. I don't want to play a sports. A lot of autistic kids don't like that. Oh, no, you have to. That's part of our curriculum. Wow. So I just, you have to advocate for your child. You have to be prepared that therapies might not work, but you have to also advocate and shoot for the stars, and really interview your therapist. Do they know autism?
Yeah,
do they know it? Do they get insulted if the ABA therapist says something to them like, don't give them a sensory integration diet when they're doing this. It's more behavior related to this. And OTs and our profession, I think, did a disservice for the autistic population. It's my opinion, and my opinion only, and I'm probably going to get a lot of flack from the OT community. When a child is sensory overload, to throw them on a swing or put them on a ball for proprioceptive input, or, whatever, till they, they're in happy land. Now you want them to come back and, let's say, read a book with you. They don't want to read the book. They want to swing. I mean, wouldn't you want to do something fun like that than address something that's hard for you? There's a fine line between sensory integration and ABA, and you have to, in speech therapy, because speech is very important with autistic children, to find that fine line. So I just ABA isn't really mean, but you have to work in conjunction with them, and sensory diets are very important for children with autism, whether it's they need a break to jump on a ball, they need to go outside, they're working at the grocery store to push the carriages to get that input in. They have to learn how to advocate for themselves. But to take a child and throw them on a ball or on a platform swing all day long and say, this is okay, if it's not okay. And I had an argument with somebody the other day about ABA. They were saying it's like you're treating the child like a dog. You're not treating them like a dog. You're teaching them how to attend. And to learn, you need to be able to sit and attend. Any child, even if you have learning disabilities, you have to be able to learn how to sit and attend to learn. And it doesn't matter if you are autistic, you're ADD, you're dyslexic, your cerebral palsy. I don't care what your diagnosis is. You have to be able to sit and attend. And that's one thing I learned from ABA, and it's the truth.
And with your experience with your son, it's absolutely incredible, the love and dedication you had. Mm-hmm. You wanted to figure it out. You knew others were not. You knew better when others were telling you it's this or that. Mm-hmm. You knew better. Mm-hmm. May not have known exactly the diagnosis, the specific at the time, but you knew. And look, two batch. I mean, wow. Look where he's at today.
Yeah, I mean, that's the thing too. I mean, and I have a daughter who was severely dyslexic. I mean, I'm talking severe where she couldn't even rhyme words in 3rd grade. And I knew something was wrong. And I went to the doctor and they're like, oh no, she's fine. She can hear fine, blah, 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 blah. And I'm like, oh, I mean, we're reading Dr. Seuss here and she's not getting it. Well, we found out, we went to Mass General to the Learning Disorders Clinic, and she's in 9th grade and reading at a 3rd grade level. School district kept passing her. I kept fighting.
That's
finally,
that freaks me out. Yeah.
Yeah. And I mean, I had to hire an advocate. I got a great, the Learning Disorders Clinic at Mass General. They're great. I recommend if anyone lives on the East Coast, that's where you want to go. And she and my younger son too is dyslexic. So autism and dyslexia kind of go hand in hand when you look at families. It's kind of like you'll see patterns. And they learn through a systematic approach from Orton Gillingham, which is labor intensive. Teachers take it. Takes 8 years to be like a master Orton Gillingham person, because you have to learn the rules of language. You can't hear phonetics, many of them. And now my kids can read. So it is fighting. You have to fight, and yes, you have to take them maybe out of wherever you live and bring them somewhere really good. And you might have to wait a year for that evaluation. And then you go, and it's a lot, and it's a lot on the kids, and it's a lot on the family, because, it's a lot of testing and this and that and the other thing. But until you get that on paper, the school's going to say, oh, they're fine. They're fine. It's all about money. So, yeah. You know what I mean? It's all about money.
I sure do. I sure do. A gentleman, a local gentleman, Jim Wilson, comes on frequently. He's advocating for different things with education and exposing the failures of a number of schools, and how the percentage of kids in high school that are able to read at grade level, it's like 25%. I mean, it's just, and they pass them. Another teacher that I know, not from the same school district, told me that we have got 3rd and 4th graders that are barely reading at the kindergarten level.
Yes.
And like she said, she doesn't want to say that the school system is forcing her to pass them, but she has to pass them. That's so obviously they are. She just didn't want to use that, not on air. This is a friend that told me about this. And I'm thinking, so then you're behind, and then you're behind. Whenever do you catch up? And if you can't read,
you can't do anything. It's funny you say that because my thing was we're either going to pay now or we're going to pay later in the penal system or pregnancy.
Yes.
Because these kids are, and I worked in the public school too as an OT. Many of these kids, when you can't read, you can't write. People don't seem to understand that. It's not in isolation. They go hand in hand. And if you're not reading fluently and you read like this, you can't comprehend, and you can't write because you can't spell. You don't know how to spell because you can't make that sound symbol relationship. So it all goes hand in hand. Cursive is very important for these children, and the public school has done away with cursive. And the SPED directors with their PhDs, I'm sorry, some of them, but not all. We don't have time in the day. We don't have time. That's not in our framework. I'm like,
and that's basic.
Yes. And so they all be referred to OT for handwriting. Well, they're not learning disabled. They need to teach cursive. There's a difference. But I would take the kids in because I felt it was so important, especially with kids with dyslexia, because we would work on visual perception and I would work with the SPED teacher. And, that's a whole different ball of wax. But it is so sad, in my opinion. The public school should be increased to an 8-hour day. This is my opinion for all students. I believe that they should have, at the end of the day, they get to go play on the playground. They get to have structured, like a recess or whatever, gym, or what, play a sport. And then I think they should have to come back and do homework club with a paraprofessional and a teacher, and all the kids who want to go, not forced, but are there so they can get the help they need in these subject areas too, because parents are tired. And when my son went to the private school, both of them went to private school, but, that worked out great. I mean, they come home with no homework. It's a longer day, but they're learning. And I really believe too, that children need recess breaks in school. They need more recess, because imagine if you sat there and I think we believe we need to be in rows, not these pods of 6-8 kids. You're turning your head like this to look at the board. It's fatiguing. They're all like this. They're hitting each other. I mean,
You're showing me, for listeners, go ahead.
Yeah. I mean, we have to look at, we can't have these people in ivory towers making decisions for the schools, because we're failing the children, whether they're disabled or not. And the few that are really making it in the public school are very, very smart kids, because it's hard. It's very disruptive to be in a classroom. It's very noisy. And as an OT, even the teachers say, I don't know what else to do. And I feel bad for the teachers. I felt so bad.
Good teachers,
Good teachers.
The good teachers
Good teachers, and they try to help the kids with autism. They try to help the learning disabled. They have a paraprofessional in the room. But first thing I'd say is, we need to stop these clusters of children in these pods. Oh, the principal won't let us. Well, then I had to go fight with the principal. Please, can they be in rows, or, 2 to a buddy system, something, because they all have to be facing the board. You can't have your back to the board and learn and then be turning. So I just want to, that's important too, for parents to go into these classrooms and look how they're set up. Talk to the OT, say, what can we do so our children are not so tired in the classroom? I honestly believe when I was a kid, we had morning recess, we had 2 morning recesses, we had lunch recess, and we'd have an afternoon recess.
Wow.
We were all attending. We weren't like this all day jumping around. They're not ADD. Kids aren't all ADD. They need movement breaks throughout their day. I mean, even through middle school and high school, they need to move, whether it's taking a walk outside or, whatever. This is really imperative to our children. And we're trying to make them little robots to sit in a classroom and have lunch break, not talk, go out to recess for 2 minutes, come back in and sit there again. You can't do that to a child. I mean, even an adult can't do that.
I was going to say that's difficult. Yeah. I don't sit well. I've got to get up and move, and I fidget. And this is, so and you're taking kids and putting them in that environment. And I just don't, I don't get that they don't hear that when you're saying about what is needed and what is necessary with your experience, with your education. You shouldn't have to fight for things like that. I just, and the other, when you were talking about cursive, I was talking about this with earlier this morning, and I think it was a week ago or so, former guest, it's become a friend of mine. He's a professor at a university on the East Coast. He said, Louis, I've got my first freshman, my first student that can't read cursive. Because I had heard, again, and you're involved and you've got younger kids. I kept hearing they're teaching cursive, some they're not teaching cursive. And this kid goes to university and can't read cursive.
It's mind-boggling that we even now hire people to write thank you notes in cursive because people don't know how to write cursive.
Seriously?
Yes, I saw that, an advertisement. If you have great penmanship, please, please sign up and all this stuff. So it's just like to write thank you notes. They pay you. Angie, you can let the dogs out. Sorry about that.
No, I love it.
They're coming. Okay. Shh. Oh, okay. Good boys.
I'm not going to get to see him.
I'm so sorry.
Sorry. That's okay.
Quiet. Angie, let him out.
Okay.
Anyway.
I love when the animals come in.
They're like they were in her bedroom with her. But yes, cursive is very, and that's why just putting a child in front of a computer and saying, learn how to keyboard.
Yeah.
To take notes down, it's not the same for encoding. It's totally different. And manuscript printing is difficult too, because you got to pick up and reorient the pen and the pencil. It doesn't flow, and speech is fluid and cursive is fluid. So it is very important. And as an OT, especially with kids with dyslexia, they need to know that cursive because the letters everything's going in one way. I've only seen one child who could do cursive in reverse. When you teach them, they learn how to, do the loops and groups and everything, and they learn how to write, and they're not reversing letters. So it is very, very important. In Orton Gillingham, to be in Orton Gillingham, you have to write cursive. They want you to write cursive, the students, because that's part of their program. So I think parents, I've advocated at the public school in my community for more recess and cursive. The PTA was very behind me, but the principal, we don't have time in our day. So it's very, very sad.
Very sad, very sad. The education of our kids it's our future. It's the future, and they're not being educated properly if they can't read. Again, it's bizarre, Tamara, when I say that 2023, I understood it maybe years ago, 50 years ago, 70 years ago. You're kidding, 2023, and you're graduating kids that can't read the diploma that you've issued them. And then what do they do? Like you say, people are going to do their best to survive.
Mm-hmm.
And if they can't apply for a job, get a job. I mean, I know there's a lot more involved. They're going to do something to survive.
Yes. And my sister-in-law worked in a jail, and she was an educator. And she had told me third grade education, reading and writing. And they would educate them up to GED. The men and women who would want to go on to community college, she would get them in. I met some of her former clients in the field. They knew my sister-in-law because they noticed the name. And they would say, are you related to? And I'd be like, yeah. And they're like, we love her. She don't take any SHIT. And she helped us learn how to read and write.
And if you can't spell, how would you know what you just said?
That's right. And, and then it was funny because my autistic son was working in a kitchen in high school at a college in the area. They hired people that had prior records, which I think is just great. and they hired disabled people, which I think is great. I can't commend this college more than I mean, it's just great what they do for people, disadvantaged people. And my son worked with someone, they're like, oh, that's your aunt? And he's like, yeah, oh man, we loved her, you know, because they want to learn.
Sure.
People want to learn, and they got jobs, and they were furthering their career, and they had children, and they go, this is our stepping stone. We have to work, but we want, you know what I mean? Like, if you can't read, you can't do mathematics, because that's language based. So parents need to understand that your kid can do computation in their head, but if they can't read that word problem, they can't do the math. And math is now language based. So parents don't, you know, it's hard when you work all day and you come home and the kid has homework and you're like, what the, I mean, even I was like, what is this? Parents need to be educated on the curriculum, and, you know, and I think we needed to do a better job too, as a, you know, therapist, whether you're speech therapy or OT in the public schools, to say, yes, this is the curriculum, and at special educators, this is what we need to do. Looking back at my career in the public school, I think many of the children were dyslexic. They presented as attention deficit, but they were dyslexic. Because if you can't read, what do? You look out the window and you be disruptive, because it's hard. So OTs would look, and we do our testing, and then the education will say, you know, they're dyslexic, but now we got to wait for the psychologist for her report, because I'm seeing A, B. I go, yes, I saw A, B, and C, or I told the teacher in the classroom saw A, B, and C. So it's really important that parents advocate for their kids in the system if they feel like their kids cannot read, they're not writing, whether they're autistic or might have a learning disability, they don't know what it is to, yes, I want my child tested. At least it's a starting point, and then you can go from there. And I think it's very important. I think that we have so much undiagnosed people, students out there, and adults, that always knew there was something wrong. I'm not stupid, but I can't do that. I don't understand that. I don't understand math. Well, why don't, you know, some people might have dyscalculia. They can't, you can sit there with a stick pounding multiplication tables down their head. It's in one ear.
I've never heard that before.
Yes. So we work with students like that. So I love being an OT.
You've got to be able to advocate. You've got to be able to, and you're very dedicated, and your kids and the people that you work with are very fortunate.
Yeah.
You think about your son, and your daughter's got something very special coming up.
Yes, she's graduating from University of Kentucky with her MSW. This is a
Beautiful.
kid that they told me wasn't going anywhere. And you know what? We had some teachers that really had faith in her. You know, they really did. Mom and dad did. We hired an advocate, because I did hire an advocate for my children, 2 of them. Well, 3 of them really now, because I didn't want to go in as the bad guy, because I was the bad parent. I was like the Mrs. Goldberg who walks into school. If you ever watch the Goldbergs and the teachers hide, that was me. So we decided to spend the money towards an advocate. My husband wouldn't go to the meetings, because why take a day off of work? That paid for the advocate. And she was the bad person. She was the heavy. I walked out smelling like a rose. And they know the laws. They know the curriculums.
Right.
So she advocated for my daughter to get what she needed. My daughter didn't have to go to a specialized school. She didn't want to. The district said she could, but she got the services at home, and it really worked out. She's graduating with her MSW, and I can't wait.
That's wonderful. You're an amazing parent. You're absolutely amazing parent. Were you call time wise? Another 15?
Yeah, I can keep.
Okay.
Yeah. Any questions?
You're involved in that research study
Mhm.
with Dr. Alexis Henry. Can you tell us
Yes.
a little bit about that.
Oh, Dr. Henry, she was a professor at Worcester State College when I was there. I went back to school in my 30s, so I went, and she was my professor. She did psychosocial occupational therapy. That was her, that was what she taught us, because OT's roots were in psychiatry initially, and then they broadened it. So she did a lot of research on schizophrenia. And then she decided there was an interest, adolescent interest checklist. That's what it's really called. And it was a checklist done in the 50s. And in the 90s, she's looking at this going, kids don't even know what a record player is. I mean, how can they answer these questions? It's a standardized test, you know?
That's great.
And she was like, I mean, it was like, it was a methods course. So we had to do methods. So we all picked out of a hat and we picked this one. And she was just starting off the study. So it was the hardest part of the study. So we had to go through all the questions. You know, and times had changed. Kids come home, they're home alone. Parents work. Kids are cooking dinners. They weren't cooking dinners in the 50s. I mean, you know, so we had to look at all these questions. Then we came up with new questions, went into the schools and would ask the questions. And it was a paper and pencil task. They would fill in the bubble what they did. And eventually she published that in the American Journal of Occupational Therapy. And then it was published as a standardized test so that OTs can use this in the schools or psychosocial if kids are in, you know, are in hospitals or, you know, schools, specialized schools or public schools, to see where their interests lie so we can provide the therapy based on what their interests are. So if their interests are painting or their interests are playing soccer, we can gear our therapy so that they want to engage. So these are things, and these are also things that these kids will want to do. Like maybe kids like to cook, they want to cook. You know, they're cooking now when they come home for families. They're home alone. What are they doing when they're home alone? And now that was in the 90s. Now I bet you look at it, the internet has really taken off. So now you have to look at a whole nother set of questions of the internet, because the internet was there in the 90s, but not like it is today with all,
Sure.
You know, you got TikTok, Twitter, this, that, Snapchat, you know. So these are things that impact our children's lives. And it was really good to be in a study because you learn. We had to have a poster board presentation with all big universities in the area with the data. They ask you questions, and Dr. Henry, she thanked us in the American Journal of Occupational Therapy.
Beautiful.
For our class, and it really meant a lot. And she was a really good professor, and she was very, very kind. And she, as far as I know, is still working with people with schizophrenia. That was her passion. And she's not working in the schools. She's doing research and helping those with this severe psychiatric diagnoses and how we can better help these people. And I think that's great because many of our people in Boston and anywhere in the cities, a lot of them are schizophrenic living on the streets. And it's very, very sad. Very sad.
Very sad. Tamara, by the way, I've got to mention this to you when you said about high functioning Asperger's. I worked years ago with an incredible radio engineer. His first name was Charlie, and he Asperger's, diagnosed with Asperger's. He could fix like anything. Charlie, I just loved working with him. He came in one day and he said, I can do something, make this sound something. And I said, Charlie, go for it. And whatever, I can't recall now exactly what it was. And he wanted to tell me the history of the part, where the part came from, and who made the company. It was great. It was great. He just was amazing in what he could do. And I don't want to say that any longer, that I'll never forget. I remember when he did something and I got really, really excited about it. I'm hyper excitable.
Yeah, me too.
And I asked him, I said, Charlie, I said, I was just bursting with, I said, okay, is it okay if I hug you? And I'll never forget. Oh, I shouldn't say, I've got to catch myself. I remember him saying, you can hug me, Louis, as long as it's okay that I don't hug you back.
Oh, isn't that great?
Oh, it was great because he seemed to appreciate the hug. He didn't hug back. And I was like, it was great that that was it's a wonderful memory.
That's a great story because, it is true. And it's funny when people meet my son, they don't know he's autistic. They just think he's smart. And so, a matter of fact, we're friends with some people, and long story short, their kids never knew that. Their kids are adults too, in their 30s, 20s and 30s. They didn't know that my son had autism. I mean, he's met him, we sit with them, have parties with them, all this stuff in the summer. And they're like, one of them says, my God, they're so smart. He's so smart. And Jeremy goes, he knows so much about everything. And I says, Jeremy, how do you know that? And he says, I know it because it's a filing system in my head. So when I read or see something, I file it in there, and then I can access it at any point in my life and talk about it and know what I'm talking about. And it's not just regurgitating the information. It's he can have a discussion about it. It's really, really odd, and to hear it from him, it's like, wow. He goes, it's a filing system. That's, it's a filing system. So he's really into he's really into government and history. And he listens to all these things on podcasts and reads papers and reads books, and he files it all the way. So that's why it was funny when you were telling me about this gentleman who knew about the part. That's his thing. Do you know what I mean? Like his things are that, and they're very intelligent, and it's how you use it. And what the ABA therapist told me, and I'm going to mention her name. Her name is Shannon Kay. She's a brilliant woman. She told me with people with autism, when that light turns on, it's like they were either watching TV or doing something, and that's what they will perseverate on for the rest of their lives. So this gentleman might have done something with electronics or saw something on TV that my son, it was animals, and that's what he went for. It was just like, and then he got into the history. So she says, it's functional because you can do something with that. Some people tune into something not functional, which counting the streetlights and how long they stay on, 3 seconds. Like she's had clients like that. She goes, what are they going to do? Go work on the DPW maybe. Some of them were really into the weather, and now they're they work for the TV station. So that was really, I learned something from Shannon about that. I never knew how people that gene just like that turns on in their brain at that time, like Temple Grandin. Hers was with the cows.
Yeah.
So it's
about in my very early rate of 20, maybe 22, 23 years ago, she was on with me and just blew my mind.
Yeah.
Temple Grandin. She's just amazing. An amazing example also.
And that's a woman, just so parents understand. She has that squeeze machine that she uses for her sensory input. It's in her office or at her home. I'm not sure. I can't remember. But see, that's functional sensory integration. She knows what she needs when she needs it. She doesn't sit there all day, or any person that sit there all day and go through this machine for pressure. She knows when she needs it and how to advocate for herself. And this is what OTs need to teach employment, people who employ, educators, parents. The greatest asset is to have a person with autism to advocate for themselves of what they need and when they need it. And I think that people with autism are an asset to businesses, especially some of them with tedious work, that things we might not be paying attention to detail. These people pay attention to the detail. Let's say it's reading a manuscript.
Yeah.
They'll see, that needs a comma there. I think that they're really good assets, and they're really the people I know are very good employees. They don't want to miss a day on the job. They don't call in sick. They might be a little quirky. They might not say hi to you in the morning.
Yeah.
But it's not that they're being mean. It's just that they're in their own world. And that's
doing your
okay,
job.
you know.
Yeah, like I said, it makes me think of Charlie and how he was, and
Yeah.
it blows my mind when I think about all the things he did and all the things he knew, and putting up with me with my being very excited when he did and letting me hug him. I want to ask you just a couple more questions. When you worked with neurological diagnosis, obviously self-serving a little bit, Parkinson's, dementia, et cetera, you've worked with people with Lewy body dementia.
Yes.
What can you tell us?
It's a devastating dementia. I'm sorry to say,
No,
but I'm sorry, Louis. It is. I mean, and
it's what it is. I'm very pragmatic about. Forgive me for interrupting you. I was grateful to finally be diagnosed because I asked you a question. Now I'm interrupting you.
That's okay.
But I got to the point where I started to not jokingly think I was crazy, or really thinking there's something. I mean, I'm insane. I'm thinking I'm doing this to myself, until some physical symptoms started to develop. And so I'm sorry it's this diagnosis, but it is what it is. And at least I know what it is. And that chasing diagnosis can, certainly for a parent with a child, but just knowing what it is. And you say devastating. I'm sorry, I'm interrupting again.
That's okay. No,
devastating when you've seen it, when you've worked with people. What can you tell us?
Well, first of all, just like you, these people, they were blindsided. Like, I can't believe this has happened. A lot of them come into the rehab unit when I got to them, because maybe from a fall, something had happened to them that they needed rehabilitation. I didn't see a lot of Lewy body, but I've had a few patients with Lewy body dementia. The greatest people, so kind. They usually, they kind of a little introverted, the people I knew, I think because they were afraid to maybe open up to a group, like, if we were in the gym working or wherever. I try to, I didn't want to provide therapy just in the room for them, even though I needed like my therapy, just so you could have an understanding with someone with Lewy body dementia, might be getting ready in the morning at the skilled nursing facility. And even though they could dress and stuff like that, that's working on processing, sequencing, those types of things. I get a lot of information from that. Are they forgetting to brush their teeth? Are they forgetting their socks and they're walking up? So I would do that. And then and it was a quiet environment, so they could really focus on what they needed to do. Then when you brought them into the gym, noisy, there's a big gym, kind of echoing, people laughing, yelling, music might be going, people are throwing balls, walking in parallel bars. It's very overstimulating. I never saw my patients act out like, I gotta get out of here, get agitated. Like, I never seen that in the gym. But sometimes they'd say, I need to leave. Like, they get overstimulated. It was too much for them visually, I think, and auditorily. And like I said before, we would work on, even though they might not need a walker at that point in time, I would ask the physical therapist, can we address this? Can I work on getting out of the chair and using a walker with them so that we can kind of train them, and then the wife could carry it over, the husband, say the wife or whatever, at home, so that skill set, so they'll be safe at the walker level when it comes to that time where they need that adaptive device. So those were the types of things that I know people say, I don't need it now. No, you don't need it now. I agree with you 100. The physical therapist agrees. I agree. We all agree. We're all on the same page. but use it once in a while. We're going to keep it in your house when you go to the bathroom. Maybe use it 4 times a day to go to the bathroom or the kitchen, just so you remember, okay, it's there. Oh, I got to stand up. I got to push up with my arms and not keep the walker 50 feet in front of you, so you're safe. So you don't tip over with the walker, or if it's with a cane, whatever the physical therapist decides what adaptive device that person may need. So those are things that we worked with. Maybe we also would teach them too, like with setting up maybe their plate for visual perceptual for scanning. So they know we might orient their meal like, okay, to the left here. And I would maybe tap or put my finger and go, look here. Okay, you have your meat. And at 12 o'clock, you have your potatoes. And at 3 o'clock, you have your corn. And we would set the plate up so that they could access the plate, whether it was from a physical or visual perceptual problem. Also, maybe give them adaptive device to eat, because the tremors, if they're eating and they're having tremors, the food may spill. So we have weighted utensils or a built-up handle with a little bit of weight. So we have rocker knives. There are things, scoop plates. We have dice them that we can put the plate on. So if you're cutting your meat, the plate isn't shifting all around, which can be frustrating. So there's a lot of things out there that can help people with neurological diagnoses like Lewy body as things progress, to make people as independent as possible. Now, you were saying with swallowing, the speech pathologist may say at some point, I don't know, you need to drink out of a straw. That helps. And you need to do a chin tuck like this so that so it goes down good, or turn your head to the left or the right because of the difficulty with the swallowing. So there are certain cups that you may want a different type of straw able to access it. So there's a lot of equipment out there that OTs can help with, and you might not use it all the time, but when you might be having a bad day and you might need it.
Yeah, which is good. But again, better to have it and know what to do with it than to go through those struggles. Tamara, I've got to say, when you said about sequencing and getting dressed, I remember, it was maybe a couple of months ago, I had to go somewhere and I'm standing there, and I know this sounds weird and to people, but I'm looking at my shoes on the floor and I've got my pants in my hand, and I'm thinking, do I put my shoe? It sounds dumb even now when I say it. Do I put my shoes on first or pants? And of course, it's somebody that doesn't, of course it doesn't make sense, but I struggled with it for a little bit.
Mm-hmm.
Yeah. And I figured it out, obviously. I mean, I don't want to make it wasn't an hour. It was just like, but I remember doing that. And I also remember a while back, I was exercising and my shoe came on, my one shoelace was untied, and I got down and I could not remember how to tie my shoe, which I've been doing for well over 60 years. It was strange. Again, when I've had people, a friend might say, come on, you couldn't. I said, I couldn't. And it was upsetting and frustrating. And I said, what'd you do? I said, I tucked them into the shoe. And when I got back, somebody helped me tie them, and then I put duct tape over them so they wouldn't come undone. Okay. Well, it worked for me. Mm-hmm. We'll need to these things happen. Mm-hmm. And it can be very frustrating.
They can. And if it would happen in the therapeutic process, like if we were working together, let's say you were getting home health services, just so people know out there in the world, your doctor can refer you to home care, services at any time when they feel that you need them. For anybody with any type of diagnoses, even if it's just, it could not even, but if it's failure to thrive, they're not eating right, they want they want nursing can come in, PT, OT, speech, home care can start. But like, let's say it was in a home care situation and this happened to us, Louis, and you're sitting there and you got the shoe in one hand, like he's in the pants, and you're looking at me, I'm probably not going to give you that answer. I'm just going to wait it out for a little bit and then say, okay, let's think about this. Do you think you could put your pants on over that shoe?
Yeah, it's
Just a little cue. And oh no,
yeah.
you give that person that opportunity, or if you see the frustration, then you intervene. It is a difficult thing. It's like having a real big blimp in your screen. It's like, wait a minute, what am I doing? And it's scary. It's scary. I can't imagine, having that happen to me. But with a therapist seeing that, and that's why therapy, like doing a functional task like that, or let's say home care came into your house and said, okay, Louie, not dressing. Let's say we're going to make lunch today. I've done this with patients. Let's make lunch. Oh, you can get a lot of data from that. Safety around the stove, sequencing. What, how are they maneuvering around? What can we do to simplify these tasks of everyday tasks to get something to eat? Where should we put the bowls? Where should we keep the pan? Should we keep the pan on the stove? There's a lot of stuff we get from a task, and people don't understand. Like, I might come into the house, do an evaluation. Next day I'll say, oh, next time I come, we're going to make lunch. And they're like, lunch? That's not therapy. I go, no, we're going to make lunch. I want to see how you maneuver with your walker or with your cane, or how you process making lunch. So somebody with dementia, you get a lot of information on that, because people with dementia, they don't function that great in the late afternoon. They kind of get a little they get more discombobulated, and in the morning they're not. Noontime they're pretty good. So even if I said, let's, a lot of people with dementia, I'd like to see them at varying types of the day. So if people get therapy, see how they act in the morning, getting maybe ready for the morning, noontime, and late afternoon visit, and see if there's any discrepancies on their functional, on how they're acting functionally, with memory and physically, because a lot of times the physical will kick in too in the afternoon, more so than in the morning. In the morning, it might be a little bit to get up and go, but once they get going, they're going. But then you'll see that usually you'll see a downward trend with neurological in the afternoon from fatigue, muscle fatigue, endurance. So like you working out, like you say, very important. Very important. That's why even like if PT came in the house, all right, let's go for a walk for someone so that they're safe. Let's go outside, get a little exercise. Let's do some of this. Let's do some of that. It all kind of incorporates. Diet is very important too. Because if you don't eat and you're not getting proper nutrition, how can you engage in your everyday life? So it's all interconnected. And
you're wonderful. We've communicated over the past, I don't know, couple of months.
Yes, few months.
And I'm blown away by how driven you are to help with such a heart. What you've done with your kids, your personal experience, and those struggles, and how you advocate for people and your kids. And you weren't going to just say, oh, again, the easy go-to thing might say ADHD, we're going to prescribe this. I'm sure there are some young people that really need that medication. Obviously, I don't have the education to judge that. Yet sometimes I think it's shouldn't say too easy. That's a go-to thing. And sometimes some people in the medical profession, it's very rote. It's like this, then you do this, then you do that. And I just, what you do and advocate and your experience, I'm just blown away, and your heart.
Oh, thank you.
With everything, all the challenges that you've had, you still have such a loving heart. Well, because some people get hardened by things, and I'm not judging that. If you had a child that I can't judge that, I won't judge that. Yet
No.
I will say you're amazing how you've kept such an open heart and your desire to help people.
Well, I did leave the profession in January of 2020. Be truthful with you, I left because insurance, the medical model has changed. It's all about money.
Yeah.
People are not getting what they need. Some people would be discharged from hospital to come home, not go to rehab prior COVID, which they should have gone to rehab, but they didn't want to, and that's their choice, but they should have the home services. Justifying therapy, fighting for your patients. I spent more time fighting for patients and, with insurance companies and management. And after a while, it wears on you. I don't have the answers. I don't, about how we should proceed with medicine and, whether it's socialized, fee for profit, whatever. But I do know this, in 25 years, it has changed dramatically, even with Medicare, Medicaid, and private insurance. And we really need to, as healthcare professionals, advocate that this can't go on anymore.
I know. I know someone that left. Go ahead. I'm sorry.
No, it's okay. That's why I left. I miss my career, but I don't miss the BS that goes with it.
I know someone similar, Tamara, that left because of the insurance wouldn't allow this person to spend the time that they needed. There was just it was just a mess. And this person wasn't able to do what they were driven to do, that they knew was helpful.
Mm-hmm.
And it's a mess and left that profession.
It is a mess. And when they tell me in home care, I have a tablet and I'm working on showering with somebody in a home environment, and I'm working on, getting dressed and toileting. How can I be sitting there documenting in a bathroom, which is number one, unsanitary to begin with, possibly drop this thing? I mean, it's just like, it's not right.
The focus on
they call it point of service documentation, which at points, yes, you can, when someone's taking a break, get into the thing, take their vitals. That's different. I said, I'm not bringing my tablet in no bathroom. Would you do that? And they look at me like I had three heads. I go, that's disgusting. And you talk about
and you're trying to focus on
infection control, and you let me go in someone's bathroom with a laptop. Or with and you're going into people's homes. Some people, their homes aren't the cleanest either. It's their home.
Sure,
I can't tell them to clean it or whatever. There's a difference between pick up and dirty, that was another thing. And so at home, I do my documentation at home, which I didn't mind, but then there's a lot of things that go into it. And it was just getting to the point of like, this isn't good. I advocated for my own family. I've advocated for kids in the public school. I've advocated for my patients in the field, whether it's in skilled nursing or home care, when I really felt that they needed it. I wasn't pressured by a patient or a family member that their loved one needs more therapy, because some people would have you go 365 days a year for 5 years for therapy because that's what they want. But that's not the goal of therapy. So it wasn't that. It was more of management and insurance. It makes it very, very difficult for any therapist, just so people understand. If your therapist looks like she's having a bad day, she maybe is, and it's not you, it's the documentation or the insurance company saying, cut that person. There's no more therapy.
It's any idea where it comes from in you, Tamara? The heart, being driven. I know it's hard for people. Someone would, if asked me the question, where do you think that comes from? I don't know, but that you maintain with all the things you've experienced, and that you still have that loving heart and that desire to help. Any idea where that comes from in you?
Because I believe in people, and I believe in therapy, and I believe in the medical model, and I believe that we have to try, because, at a point too, you have to tell a patient, you're not going to use your left hand. That's hard to say, but you have to address it. I think people tend to write off people quickly. And as I age and I see it more and more, I mean, I had some 90-year-old patients that could run circles around 50-year-olds, just because age is just a number, in my opinion. But I think too, seeing what people have done for my family, for my kids,
Beautiful.
Teachers, therapists, doctors who went to bat for them and spoke the truth. That's all I ever ask. Speak the truth and let me fight the fight. Just tell me the truth, because if I don't know, I can't advocate.
You've got to know the truth. Yeah.
And
don't soften it for me. Just tell me.
Right. And I think what really put it in perspective is two things that happened in my life. My son was, quote, called mentally retarded, and my daughter basically was called the same thing during an IEP meeting, where my husband almost jumped out of the chair and wanted to strangle the special ed teacher. To say something when somebody has a disability and the testing is showing a low part, let's say, okay, it's academic testing, and they're low, their IQ is maybe an 84, but that's because they haven't been remediated yet in their area. You don't go labeling people MR. I mean, or they don't call it anymore that, but cognitive delays. So I think that kind of put a fire under my butt. And I am friends with an advocate. That's her job. She advocates for disabled people, veterans, and children. And she goes to school systems, and she was my advocate, knows her stuff. Learned a lot. We talk a lot. She calls me up, bounces things off me in the public school. Do you think A, B, and C, that the OT is doing the right thing? What do you think about this? She knows her stuff, but she'll ask for my opinion. I mean, I'm seriously thinking about maybe opening up a private practice, just to do therapy. I mean, just to do testing on students, OT
Wonderful.
testing,
Yeah.
and then do the observations in the public school. I won't take insurances. It would be private pay. I know the clinics here are a year and a half backed up. So now you have COVID, you have kids that can't get evals, from independent evals, even school system, because all these children are delayed now because of COVID, and you need to get in there. So I just might do that. I might just open up my own. And I wouldn't even mind advocating for elderly people, when it comes to going to a doctor, because I know some people don't know what questions to ask, and it's not, they don't know what to ask, like, okay, medicines or therapy and this and that. So that's, I think, having the kids like that, having kids and fought like that, and have even fought once for my own diagnosis. I mean, I knew it was, my husband was yelling at me, there's something wrong with you. And I'm like, I know there's something wrong with me, but you keep chasing the diagnosis, and come to find out I had a tumor on my pituitary. Finally, after 5 years, they figured out I had 2 tumors, and they shrunk it with Parkinson's medication.
Wow.
So, I mean, I finally found the right doctor to say, we got to do these blood tests on you. And she goes, oh my gosh, we have to do an MRI right away. And I'm like, why? She goes, oh, your levels on this. And then once that was rectified, I felt better. But it was like you said, chasing the diagnosis. I mean, I knew there was something wrong.
And you start to feel, why am I not finding out? So I think that private practice would be wonderful for you. I'm so glad that we have the opportunity to meet and get to know you, and to have you do the gig with me. I'm truly honored. You are an amazing human. And by the way, congratulations to your daughter and to you
Thank you.
on her upcoming
Graduation.
tuition with, a master's in social work. I must have been wonderful. You're wonderful.
Yeah.
We'll do it again.
Oh, I would
If
love
you
to.
can, if you can suffer me. I know I kept you a time today.
No, Louis, this has been great. And I hope people, if they have any questions, they can reach out to you. And if, anything, I mean, I would really, anything to help somebody so that they can ask the right questions or do the right thing or think they're doing the right thing, from children with autism to people with neurological disease. And all I can say is please ask your therapist what experience they have, what's their experience working, because Lewy, like you said, Lewy body dementia, it's not really prevalent. Dementias are prevalent, but you want somebody who knows that or will be willing to even read on their own so they can get, which I've done, it doesn't come through osmosis. And it also too, can they pick up the phone to somebody and say, hey, I have a question for you, somebody that's an expert or, knows a lot about that, which that's a good therapist because we don't know it all. And it's, you need to ask people in the field, have you ever come across this? So those are some of the questions and don't be afraid to ask them. Anybody out there who's considering any type of therapy, please don't hesitate to ask when they say, oh yeah, we have you for physical therapy eval. Well, wait a minute. Does she have training in vestibular therapy? Does she have training in, what's her training? Does she have certifications? OT, PT, speech. You wouldn't go to a speech pathologist who doesn't do swallowing disorders because you want somebody who's versed in swallowing. So these are things that people out there, please ask the questions. No one will be offended. And if you have to wait a couple more weeks, till there's an opening so you can get the care you need and work with your therapist. And remember, it's patient-centered. So it's your goals, not their goals. So when at time of eval, you tell them what your goals are. Don't let the therapist dictate the goals because they don't know. I just want to instill that because that was instilled in us in university. And I've seen that kind of drop off the page. Just so
I like what you say about the questions, because you don't know to have someone help you with the questions that you need to pose to your doctor or whomever. You don't know. I know with mine, it's like, what? It's called what? I think I shared with you off air when I told a dear friend of mine, he laughed and he told someone else that's close to me that he felt really bad because he thought I was teasing. He teases me a lot, lovingly, but teases a lot. I do likewise. And he thought, when I said Lewy body dementia, he thought I was talking about Lewy like me, like L-E-W-I-E, not L-E-W-Y. He thought I made it up to make a joke. And you've got to find, like you say, you don't know. You don't know what to ask. You don't know. So to have someone help you would be wonderful.
And thank you. And just so you know, Louis, if you do go to the doctor, you can always ask your therapist too. Hey, what about this? So you can ask your doctor. Sometimes the therapist will say, you need to ask the doctor A, B, or C, or I may have to make a call because I'm not sure about A, B, or C. So it's a team and the doctor is part of that team or the physician assistant or whoever may be, or the nurse practitioner, therapy nurse, they're all part of a team and no question is stupid. My father always taught me that. So I'm going to leave on that note. No question is stupid.
Unfortunately, too many that people think are, then they don't ask and should always ask. You are absolutely wonderful. If you could stay with me 1 minute, I got to take a picture of you. I up from the screen if you're okay with that.
I'm fine with it.
I've loved this. I've loved this. And I'm thinking about the circuit, how I got to know. This is wonderful. Tamara, thank you.
Thank you.
Thank you so much for who you are in our world.
Well, thank you for you are a decent person. And thank you for having me on. I'm so happy you made my day, Louis. You made my day.
made my day. Thank you. Thank you. Folks, I will be back with some closing words right after this on the Louis B. Free Radio Show, Brain Food from the Heartland. Or just bear with me for 1 minute. You don't mind if I take a picture of you from the screen?
No, go right ahead.
There we go. Okay, now let me stop the recording.